There are two things that we want to look at when we're evaluating any calf raising program. First of all, we want to evaluate calf health shortly after birth, and second of all, we want to benchmark calf performance from that birth to weaning. When I'm evaluating this calf navel right now, I just want to make sure that the umbilical cord is dry and is still not wet, so that's drying up properly. I also want to make sure that there's not any excess swelling in that navel, indicating that there might be signs of a navel infection. So another aspect that we might do in order to evaluate calf health shortly after birth is to measure calf serum total proteins. So since the calf is born without any maternal antibodies from its mother, the calf must receive its antibodies or immunoglobulins from the colostrum. And in order to tell whether or not that there was successful passive transfer of these antibodies, we must take a blood sample from about 3 to 5 days after birth. And so what you'll do is you'll take a blood sample here from the jugular vein, and sometimes it's easier if you have someone else come in and help you hold the calf. So if you pinch off the vein down below, you should be able to feel the jugular vein here fill with blood, and you just take a blood sample there and you measure the serum total proteins then in the blood. When measuring these, it's important to make sure that the calf is not overly dehydrated, as that will also inflate the serum total protein level. So if a calf has successful passive transfer, then the calf had adequate colostrum intake that was of high quality, and it was timely administered after birth.